Good evening, everybody. For those who may not be familiar, the Pennsylvania Pro-Life Federation is the largest single-issue pro-life grassroots organization in the Commonwealth, with over 100,000 individual contributors across the Commonwealth and 40 chapters in 67 of the counties. As was mentioned, I've been the executive director for 10.5 years. And before that, I was a professional hospital administrator for 31 years. I have a master's degree in health administration from Baylor University, and as was said, I'm a fellow of the American College of Healthcare Executives. As we get ready to get started here tonight, Father reminded us what John F. Kennedy said about religious freedom. And I wasn't going to mention this, but if anybody was following it, the Secretary of Health and Human Services, Secretary Sweebliss, was honored by a Catholic university recently, Georgetown University, had her in to give the commencement address at this Jesuit college. And Secretary Sweebliss had the gall to quote that same quote that Father just gave you this evening about how important it was for us to fight for religious freedom, and how, even though that was 50 years ago, these are things she told the graduates that are still being discussed today. And I was so disgusted, because the reason we're discussing it today is because she and her president have foisted upon this nation and this church at a complete affront to religious liberty. That's the reason that we're here tonight. We're here tonight because the President and the Secretary of Health and Human Services have mandated that all employers must provide free of charge to their employees artificial contraception care as part of their health care package. All employees. There is only one very minor concession in that mandate, and that concession is that churches, individual churches, whose main job and really only job is to provide worship services for people of that faith and to provide services of that faith, and whose employees, small number of employees, are all members of that faith, those are the only employers that are exempt from this. Every other employer, if you are Catholic Charities, if you are a Catholic hospital, if you are any kind of religious organization that finds artificial contraception as something that goes against your morality, you must provide that in your health plan to your employees at no charge to them, and you have no choice. You have no choice, and if you don't follow that mandate, you will be fined on a daily basis, and there will be other ramifications. That's why we're here tonight. The First Amendment of the Constitution of the United States guarantees us the freedom to practice religion. And never in the history of our nation has anybody disregarded that as this administration. And for Secretary Sweebliss to quote religious freedom in front of a Catholic group of graduates, it just shows you these people, there is something going on here that is almost evil. It really is something we have to really pray about, because it really is. Now, this mandate must be revoked in some way. As many of you know, many Catholic institutions right now are suing the United States government not to have to participate in this mandate. And I cannot believe any judge in any court who has read and studied the Constitution of the United States, when this is brought before them, will not overrule this mandate. I cannot imagine it. But courts have done such things in the past, and we're not sure exactly how these suits will come out. But this mandate has got to be revoked as soon as possible, because as radical as what I just told you is, if the president's mandate is allowed to continue, we believe that this is just a scam to open the door to future mandates that will be much more alarming than a mandate for artificial contraception. You see, the president's position is that basically all employers can be required to provide contraception for free to their employees, because the president contends that birth control is less expensive than childbirth. How does the president reach this conclusion? Well, he believes that birth control prevents pregnancy and saves the much higher costs of prenatal care, child delivery, those pesky pediatric bills, when kids get sick, and frankly, all of the health care that child will consume for the rest of their life. And so it's much cheaper to provide artificial birth control, because by preventing children from being conceived, you are now saving all of this money in our country. Think about it. Without all this contraception that's now being mandated, there would be a lot of babies. And frankly, the first prenatal visit, until those babies take their last natural breath, they would be jacking up healthcare expenditures in our country. I could take this very personally. You see, my mom and dad had 15 babies. Think about it. Me and my brothers and sisters, I calculated it out last night, and up to this point in time, we have actually lived for 765 years, if you add up all of our 15 ages. Now, 765 years, that's a long time. My mother, who is a living saint, by the way, and my dad, may he rest in peace, thought that they were blessed. But you see, I don't think the president looks at it that way. You have to remember, first of all, this was the gentleman who, in Johnstown, Pennsylvania, during the last campaign for the presidency, was directly asked, what about abortion? And candidate Obama looked at the audience and he said, Michelle and I, do a really good job of raising our girls to be good girls and to be moral girls. He said, but if one of our girls made a mistake and got pregnant, I would not want her to be punished with a baby. This is the attitude of the president when it comes to babies. So I don't think the president would be really too happy about my mom and dad having all these kids. What he sees is one family contributing to healthcare inflation by 765 years so far. Even though we are all relatively healthy, we do use medical services from time to time, and that's exactly what the president wants to stop. Imagine if my mom and dad had gotten married in an era of employer-provided artificial contraception. And imagine what might have happened if they could have been educated by the government that children are a drain on the healthcare system. Perhaps they would have stopped having children after me and my brother Steve were born. Now let's do the math, okay? Instead of 765 cumulative years of the 15 of us raising healthcare expenditures in our country, now just the two of us, just me and Steve, we would only have 117 cumulative years. Why, that is an 85% reduction in healthcare expenditures in just one family if my parents had stopped at 2. And so now you are seeing that the major objective of the president's healthcare law, didn't they tell us when they were trying to sell us on healthcare reform that it was because there were so many people out there who didn't have healthcare coverage? And so we needed to have healthcare reform so that these people could have healthcare coverage. Okay? But you see, the dirty little secret of healthcare reform is not that we have to get all these people covered. It is that we have to lower healthcare expenditures in our nation. And this is just one example to show you. The law's main objective is to lower the amount of money spent in the U.S. on healthcare. Not just lowering government expenditures on healthcare, they want to lower all expenditures on healthcare. Therefore, you can see, can't you, that this contraception mandate reduces healthcare expenditures. Oh, but wait a minute. Perhaps during the course of their life together, my parents' artificial birth control might have failed. We all know that there is no artificial birth control that is 100% effective, is there? So perhaps any one of my other 13 siblings might have accidentally been conceived. Then what? Well, this leads to what I said earlier, that the contraception mandate must be revoked now before it's too late. You see, if the president is able, with his twisted logic, to convince the American people that the cost savings from the contraception mandate are going to lower healthcare spending as a proportion of the gross domestic product, then the contraception mandate is just the tip of the iceberg. So what can we expect next if President Obama has 4 more years to actually impose this law on our nation? There will be nothing to stop him from ordering all employers to provide full coverage to their employees for elective abortions. The same logic that applies to the contraception mandate would apply here. That is, babies raise the cost of health care in our country. Just think of the much higher costs of the prenatal care and childbirth and the care of the baby from womb to tomb for those that, well, they happen to be conceived because of failed birth control. Following the president's radical rationale, then, an abortion procedure is much cheaper than a lifetime of health care expenditures. An abortion mandate would save a lot of money in the long run. So let's say my parents' artificial birth control had failed under an Obama-like system of health care. Suppose Bob, or Dave, or Dan, or Pete, or Ann, or Martin, or Linda, or Kevin, or Paula, or Adeline, or Barry, or Amy, or my little brother Frank might have been accidentally conceived, despite my parents' best efforts to prevent their existence. Well then, the only way to stop any one of them from becoming a drain on the American healthcare system would be to provide my parents with a free abortion as soon as possible. Again, it's only logical. If you buy the first lie that free contraception is needed because children burden the healthcare system and cost too much money, then you have no logical choice but to buy the second lie that free abortions are needed because accidental children will burden the healthcare system and cost way too much money if they're permitted to live. Oh yes, mark my words, the abortion mandate could be here as early as the first day after President Obama's second inauguration. And where do we go from there? Perhaps every employer will be mandated to cover physician-assisted suicide in states in which assisted suicide is legal. After all, each suicide would result in a net reduction in healthcare costs compared to the years the person might have lived and used healthcare services for the rest of their natural life. My friends, let us be clear that we have been on a slippery slope ever since human life was devalued by the United States Supreme Court when it wrongly decided the Roe versus Wade decision in 1973, as Father Daniker alluded to. Tragically for many, the president has done nothing but toss a ton of slick oil on that slope. We who respect every single life as precious from God have lost much ground over the last 3 years. We must be prepared for what will follow if this president remains in office and fully implements the health care law over the next few years. I am telling you, the pro-legalization of euthanasia movement is working in the shadows to insidiously build public opinion in favor of euthanasia as not only the humane way to deal with those who can no longer enjoy a proper quality of life, but also as an effective and efficient way to significantly lower healthcare costs. And by the time this becomes a reality, it will be me and you who will be meeting our Maker before our time. Thank you.